and welcome to an overview of giant cell temporal arthritis for the family nurse practitioner. What is temporal arthritis and who are you going to see it in? It's going to be in an elderly patient. The mean age is 70, but it can be from 65 to 80. And it's going to be a patient who comes in with a headache and has other autoimmune disorders. Autoimmune disorders are basically all in European descent females, unfortunately. So you're going to be looking for a patient who is Caucasian in skin color. What happens with giant cell arthritis, and it's actually super easy to diagnose if you know what it is the temporal artery becomes very large and it creates a one-sided head pain. When you touch the temporal artery, it's going to feel tender, nodular, and pulseless. So what's going on in there? What is happening is we're actually having a ton of inflammation around the lumen, which causes it to narrow. And the inflammation is caused by usually an RA or a polyarthritis. I don't think it has to be, but it's more commonly associated with that. What's happening in the finger is we're actually having a ton of inflammation and buildup, which is causing the destruction of this joint. Same thing is going on over here. We are going to treat this patient with prednisone. It's imperative that the patient gets prednisone right away, and it's going to be a very high dose prednisone. It's going to be 1 to 2 milligrams per kilogram. So for me, I'm about 50 or so kilograms, and that's going to be on the lighter side, considering this is going to be an older patient. They're more likely to be heavy at that point. And I would be on 50 to 100 per day. That is super, super high dose. You probably aren't comfortable giving that. You're probably going to want to refer this patient out to be treated. And then also consider that you're going to have to continue that dose for a good amount of time until the patient's symptoms really subside and we can control them with other lower dose prednisone options, and that's going to be for about 2 years. It could be 6 months to 2 years, but anticipate that this is going to be a very long course of treatment, so you're really going to be wanting to refer them out to a rheumatologist. And this is an emergency, because the reason we're treating them with this high dose of prednisone is we want the swelling to decrease. The artery is likely hanging on to the optic nerve and causing either the optic nerve to not get enough blood or pressing on the optic nerve, which can then cause blindness. You may see that the patient suddenly goes blind in the presentation. It's very unlikely that they will regain their vision. It's not like if we give them prednisone, they will regain their vision. They could be seeing double, and they're definitely going to have that unilateral headache, which we kind of associate with migraine usually. So just take that into consideration. It's super easy to diagnose if you are able to look out for the right symptoms, the right presentation, and this is definitely one not to miss.